Okay, well, let's go ahead and start, and hopefully more people will join us as we begin. My name is Sharon Ann Litch. I'm with the O'Neill Institute for National and Global Health Law, and specifically the Global Health and Policy and Politics Initiative. We are based at Georgetown University. Today, we are hosting a webinar with a number of subject matter experts to talk about the high-level meetings that are happening next week in New York City at the UN, and the need to defend and promote and improve upon certain concepts and rights, including the right to health, the right to science, etc. So just a little bit of background. So we started the HIV language compendium, which is not limited to HIV, with the financial support of AIDS funds. AIDS funds and GMP Plus, the Global Network of People Living with HIV, have a project called Love Alliance. It's a 5-year program dedicated to protecting and promoting and fulfilling sexual and reproductive health and rights globally. So what we wanted to do at the time was to defend against the erosion of certain rights that was happening at the high level, the lead up to the high level meeting on HIV in 2021. What we saw is that, again, people were renegotiating and opening up the principles around access to medicines. We thought, hey, wait a minute, much better than having these guys rewrite what was won is just have them refer to the precedents and ensure that what was won before is not eroded. Also at the time, there were a number of governments that wanted to remove any reference to key populations. So again, having precedents and demanding that those not be eroded is important. So the HIV language compendium can be considered, again, it's not limited to HIV, can be considered a benchmarking exercise, but we don't claim that the concepts in there reflect everything. We are open to your suggestions in terms of what should be added. And we consider it, while it's a benchmarking exercise, that it's also scaffolding to build upon. That by 2023, we haven't finished winning and enshrining the rights of people in international agreements. We hope that this tool will be helpful. 2 reasons. One, so that the next time there is an international agreement, that we can defend and build upon the precedents. Because after all, we live between the apex and the nadir, right? Like when things are really good, or when things happen to go our way, versus when the pendulum swings, the power swings, and those that would rather keep populations go away, or rather that pharma gets to write the rules, get in power. So at least we have in black and white what governments have signed on to. So defend the precedent, hold that watermark, build upon that watermark. And secondly, at the national level, we certainly hope that this tool is going to be useful for people working at the national level to push for codifying these rights that have been signed into in international agreements into law. So let me stop yapping and move on. So our first speaker, who will be talking about the TB high-level meeting draft declaration, is Dr. Luchika Datu. She is the executive director of Stop TB Partnership and one of the forces behind any movement we've had in TB on the political, programmatic, and science in so many different areas for the last 20 years. So Luchika, over to you, please.
Thank you, Sharon, Ann, very much, especially for the introduction. And if I want to be sarcastic, I'll say that's why we are so much behind, because Luchika is trying to move many things in all the directions. Anyway, so I really welcome very much this conversation. I'm really happy for you guys for putting it up and for bringing us from the 3 UNHLMs to share our thoughts, but also to take some things forward. And I am. It's a good timing. It's also a good timing that I speak now in the beginning, even though I will be a bit sour and grumpy and you know, a bit frustrated because for several reasons. I totally agree with what Sharon and you just said in the opening on the fact that already agreed and negotiated language should be, how to say, ring-fenced, and it should not come all the time back. However, my experience with the negotiations in the UN, as far as I attended this year, is disastrous, okay? And I was in the room and I could hear with my own ears and see with my own eyes member states literally saying, we don't want to see any language around gender. Can you remove everything that is about the rights and the key and vulnerable population? Can you remove everything that it's about, I mean, bodily autonomy and integrity is like up there in the sky, okay? As you can imagine that literally there were 2 member states that said, we don't want to see anything on gender or gender equality. We should have it once mentioned in the declaration and that's it. And these were individuals speaking up out loud and so on. So I'm not even going into the reproductive and sexual rights here, okay? So the first thing that I want to say is that I think we are having these discussions and are right, and we fight for it. And I was staying there in disbelief, you know? You are like, did I hear well? I actually went to one of these member states in the break and said, did you really say that? I mean, like, what is in your head? But you know, people are hiding behind this is the capital that is pushing me. So, you know, they close that door there. So if it is that we go this way to really reinforce already agreed language that gives, and it was already negotiated and agreed, then it needs efforts, especially at the national level and in the capitals. And it needs to be beyond some of us work traditionally with ministers of health. We in Stop TB walked away a long time from ministers of health. Ministers of foreign affairs will be extremely important because they are the ones negotiating, and believe it or not, even though a lot of them have no idea of anything on health, they have the guts to stand up and comment on that. So just to make your head explode, we were having a discussion about contacts of people with TB to get treatment. And there was another member state who said, why would we care about the contacts of these people? They can have contact with people that are illegal and stuff. We don't want to deal with the contacts. So please remove the word contacts. So we had to explain what it means and stuff like that. So my point is that all this language and all these principles, maybe, you know, I don't even know if it's worthwhile to consider other UNHLMs that will come in the coming years, because I see that, to be honest, it's a bit of a shit show this time. Sorry for my French, because even as weak, as watered down these declarations are, as far as I understand, none of them is actually fully endorsed. In the TB, the silence was broken 2 times. Don't think that was broken for any TB principles or the need to, it was broken for political terminology. And it will go directly to the UNHLM without having clarity if the consensus is reached. So we might not go anywhere. So anyway, I think that one thing for the future is literally a discussion at country level of all these terms with the right people that can be done in all together, because it's something that it unites all of us, right? And unpacking it for those that are the most vocal and so on, for understand and maintain it. People rotate in these positions in New York, and the ones coming are like, this is the new line of our government, and the capital instructed me, so I don't care what, because what you discussed before, because we used some of the things, Sharon, and you shared with us to say, look, you did this. So what? It's not us, it's a new government. The second thing that I want to say is we managed to put some in the TB declaration. There are 2 parts, 77 and 78, if I'm not wrong, in which we try to, in which we have some language around rights, around gender, around vulnerable groups and so on. As you know, the problem that I have with it, it's the terminology. There are some terms there. Some action is somehow understood between the lines, but there is nothing that you can hang, you know. It doesn't say you should deliver that. It says basically intensify national efforts. Intensify means anything, right? It goes from 0 to 1, 0 to 100. Who gives a shit? Like, I intensify my efforts to lose weight. I'm actually gaining, but I intensify the efforts, right? And then the other one is strengthen the meaningful engagement. So what we hope to do from the TB side is to say two things, to do two things. One is to try and translate this into some actions, but also something measurable to be able to hold accountable the governments. It will be a hell of a job because everybody understands whatever from this. Actually, our paragraph 77 and 78 looks like a soup in which everybody throw everything from vegetables to potatoes to shoes. Everything is mentioned there. So we will try to unpack to see what it means, what are the actions, but also, and this is something that maybe we can work together for all of this, it should be something that we should try and keep people accountable and measure if there is any progress. If you don't have something concrete to measure, it will be very difficult because, as I said, everyone will say I did something. But these are principles that are, as you, Sharana, referred, it's not just TB or HIV, it's for everything, right? So if people don't have access, if the pharmaceuticals are the ones dictating, if we don't recognize the gender, if we don't recognize the people's right to access diagnosis and treatment, if we don't recognize the sexual rights and so on, all these principles, it will affect UHC, PPR, TB, HIV, da. So we will be all in favor to come together at country level to fight for achieving something on this. So I didn't, I will listen actually, and I did because I didn't follow on the language on the UHC and PPR around these topics. Everyone around me said, in TB, they are kind of implied, and we have tools to do that. As you know, we have tools to monitor the rights with the One Impact community-led monitoring. We have a stigma assessment tool. We have a legal scorecard. We have CRG assessments, everything done by communities, not by us, Stop TB in Geneva. Huh? And also we have countries that put forward CRG, community rights and gender action plans. And in some places, even the governments understand that, but they are very few. And we can share, and rather than duplicate or complicate, we can bring together all these efforts. I don't know if this was helpful, but I am, Sharon, and I will stop here. I am a bit frustrated because we don't know what will be with the declaration. We don't know who will be in the rooms. You know, even the declaration is very wishy-washy. So we worked a lot all this year, so we need to make the most of it. So at least use the spotlights and the lights to make some noise. So thank you very much, Sharon,
Thank
for
you,
giving me the
Luchika.
opportunity. Thank you.
Of course, and if folks have questions for Luchika, she will have to run to another meeting in a bit. I just want to make a couple of comments here. One, in terms of TB, there was an addition that we get to throw on the pile in terms of a precedent, and that is the right to science. So let's see, it's got specific language, recognizes the human right to enjoy the benefits of scientific progress. That's good. That's something to hang our hat on. There were no erosions in terms of access language, but no movement towards making some of these access conditions mandatory. That extends to even the principle, so not operational, not binding, for having an explicit commitment that links government-funded medical innovation with conditions for access. So there are other times and other places. One of the other reasons that we put together this compendium is we have seen countries and negotiators try to pit communities against each other, even within diseases. So in the example of HIV and TB, we experienced some of it, but not as much. We heard from negotiators that we will approve your treatment targets if you take that vulnerable population language out. We will approve the access to medicines if you take that key population stuff out. And groups working on securing the rights for key populations heard the same, but in reverse. So obviously holding together, learning from each other, and holistically defining and defending the rights are obviously important. So thank you again, Luchika. Now we will hand over to our next expert, that is Rajat Khosla, who is the director of the International Institute on Global Health. Rajat will be walking us through what was won, what was secured, what wasn't in terms of rights. And I hope Rajat will as well share in the chat his wonderful article in The Lancet on some of the other negotiations taking place around the PPPR, that is Pandemic Preparedness and Response. Please, if you have questions for the subject matter experts, use the Q&A field so that they can type in responses and answers, and feel free to be chatty in the chat box. Thank you so much. Over to you, Rajat.
Thanks a lot, Sharon, and thank you so much for the invite as well. Unfortunately, it's the sentiment of being sour and grumpy that Lucia left us with is what I will be continuing with. But also very glad that I'm not the first one to use profanity in a webinar this time, and somebody else already did that job. So thank you for setting it up, Lucia. We feel very uninhibited, because what I was going to start by saying is that the only way I can summarize the political declaration that we have with us is that it's a big disappointment and a missed opportunity. And what we have in the declaration, unfortunately, can be best described as half-hearted, half measures. There are some perfunctory references to rights in the declaration, and if you read through them, they are mostly contained within the preambulary paragraphs, and some random references that you will find to intellectual property rights and other things in the operational paragraphs really do very little in terms of adding any specificity. But let's just look through some of the specific issues within the political declaration on pandemic from a rights perspective. I think the first thing in terms of a general comment that I would like to say is that the declaration does very little in terms of advancing the discussion on pandemic preparedness and response. I think the first 5 pages of the declaration, which is like 29, 30 preambulary paragraphs, could literally be all deleted, because they add nothing new. They are at best can be classified as an acknowledgement of what happened during the pandemic, and with very selective memory with which those paragraphs have been written. If you look at the commitments that the declaration has, it's unfortunately even worse, because there is really no commitment being made in the declaration besides the point that they're going to meet again in 2026. And some of the key rights issues that I will briefly detail in the next few minutes, whether it is around addressing inequalities, vulnerable populations, accountability, international cooperation, funding, and all, have literally been all glossed over. And with some very vague or weak language through which some of these issues had been described and talked through. So, it is very worrying, because it does signpost where the commitment at the heads of state level is when it comes to addressing what happened through pandemic and mitigating how we will address a future pandemic. And if this is where we are, it is very worrying what will come out of the negotiations around the Pandemic Accord and the International Health Regulation amendments, which are going, as everybody knows, simultaneously, but also from a very real life perspective, if there is a next pandemic that would happen, and if this is the commitment and declaration that we are going with, we'll probably end up with the same conclusions and outcomes that we did with. But let's look at some of the specific issues. The first one I wanted to talk about was accountability and governance issues. One of the key dimensions that we all lamented over during the pandemic and after the pandemic, there were specific issues that came out within the pandemic, whether it was state overreach, it's usurping of rights, imposing blanket measures without necessary checks and balances, the whole issue in terms of collapse of international cooperation, and there not being anything in terms of holding those to account that had responsibilities, but also specifically in terms of pharmaceutical companies and the role of private sector. And instead of addressing any of these issues in a meaningful manner, or talking about what an accountability approach or mechanisms should look like and how we should address these issues, the declaration, not so surprisingly, or maybe surprisingly to some people, spends more time in terms of re-emphasizing national sovereignty as the key issue that needs to be safeguarded. And so it does talk about in great length in Operation Photographs the need to reaffirm the importance of national sovereignty and show the government, can do essentially whatever they want. And there is absolutely nothing in the declaration about holding private sector pharmaceutical companies to account for their human rights responsibilities, of which, there are several, and something that I do not need to detail about. So when we are talking about, for instance, in the context of the pandemic accord, the importance and the essential nature of both addressing this power imbalance when we are looking at the state's ability to do what they need to do, but the weight that they are put under because of the private sector influence and their dominance, or the need to have an independent mechanism of accountability to hold governments to account, this declaration does nothing to address any of those issues. The second of the issues in terms of addressing the needs of the vulnerable groups or addressing inequalities, whether it is in terms of access to technologies, transfer of research and other things related to it. So when you look at it in terms of addressing the needs of vulnerable groups, the declaration uses very weak language references. It talks about the need to address, the need to support measures, and there is very little tangibility. But, if you look at the compendium that you kindly shared with us that O'Neill Institute has prepared, there's nothing even remotely close to addressing the specificities and the vulnerabilities that those two affect. There is not even a reference to LGBTI populations. There's nothing in the declarations that would address the kind of vulnerabilities that those groups face if this or another pandemic was to happen again. And then if you look at it in terms of issues in terms of transfer of technologies or the imbalance between high-income countries and low and middle-income countries, and the challenges that we faced in terms of, one set of countries stockpiling masses of, pharmaceutical products, countermeasures, and so on, whereas the others were struggling to get the first jab, and there was the, the price hedging and everything else that they've gone. The declaration, again, does very little in terms of addressing those imbalances and what needs to be done. And instead of previous drafts had stronger language in terms of addressing some of those imbalances, and it has been watered down to more innocuous framing around these issues, whether it is in terms of referring to promoting these dimensions or talking about urging governments to take steps rather than identifying concrete ways in which these issues can or should be addressed. And I think this is shameful, to say the least, that the declaration has left us there on these issues, which, literally impaired our ability to address the kind of things and led to the levels of preventable mortality and morbidity that people in low-income countries specifically had to live through. The third issue is that of financing. And you look at, operational paragraphs 44, 45, 47, and what you find is very, very rhetorical references for the need to address these issues. And it talks about vague concepts and ideas around, global solidarity being important and the recognition that financing needs to be addressed, but it at no point says how or what the governments need to do. So it just basically, yet again, leaves it at some esoteric references about what the nature of these obligations are, rather than actually detailing in any meaningful manner what needs to be done. The final bit is the whole issue of compliance and international cooperation. And as we know, one of the big issues that needs to be confronted alongside issues around accountability, transfer of technology, and everything else. And yet again, this is where the declaration leaves much to be desired. There is, no references to legal obligations. There is very little in terms of what kind of mechanisms and approaches that can be or should be adopted to address these dimensions and what should be the role of such mechanisms and whether there should be some sort of what the discussions are right now in international bodies such as a threat council or what PPR and others are proposing to address these issues. How do these things get escalated and addressed if countries are not cooperating, if challenges similar to what we faced are being faced? To end, I go back to where I started with. It was a huge opportunity that we had with us to move the needle forward, to address the kind of issues that would make a difference in terms of addressing national level preparedness and response. But if this is the political emphasis that we are getting on from these HLNs on the topic, there is very little appetite that we will have at the national level to see the follow-ups that we would need. To repeat again, my big worry is what kind of influence this will have on the negotiations for the pandemic accord, which we, as we know, are hanging by a thread right now, precisely because of some of these issues that we just talked about. Thanks again, Sharon, and back to you.
Thank you, Rajat. So certainly we see the impact of weak or dangerous language, omissions as well, versus strong language. And as you hear in the sort of domino effect, we will certainly meet those missed opportunities again in the negotiation around the pandemic accord. Rajat, thank you so much. I do want to flag for people that are online, there is a nice analysis that was put together around key themes and then specific asks for the PPPR. There's also one on TB that I'll put up, and the groups know who they are, but got to give them credit where credit is due. So thanks to GFAN for working on both stocks. Thanks for Stop TB Partnership for funding the GFAN effort, AVAC, HealthGap, GMP Plus, ITPC. I see some of you on the call. So that's where you can go to see what made it, what didn't. There is a common thread, and I want to call out here somebody else. Nina Schwabi has been watchdogging the PPPR negotiations as well, with a focus on the lack of that compliance mechanism that Rajat spoke about. So all of the words on paper mean nothing unless there's accountability. They have less teeth if there's not a compliance mechanism. And for some of us, we certainly have been pushing for the next opportunity to take stock in order to instill some accountability. It's like, you promised this, now you got to show up in 4 or 5 years and to report where we're at. Also, to get the UN to report on progress is somewhat useful. There's some tricks and tools, but at some point we need a reckoning in terms of where words fail in terms of being turned into action. Okay, on to UHC. Luis, I hope you have some better news for us. And that draft agreement on universal health care. So Luis Gil Abinader, I am so embarrassed. I've known Luis for so long, and here I'm butchering his name. You would never believe that Luis and I actually work together in the same group on the same issues. Luis is a fellow with the Global Health Policy and Politics Initiative at O'Neill and has been such a fantastic help in ensuring we look through the lens of access to innovation throughout our work. So over to you, Luis. Thank you.
Thank you, Sharon, and I'll have news. I don't know if there are good news, but there will be news, which is that although some marginal progress will be made, the 2023 political declaration can mostly be considered a missed opportunity, very similar to what previous speakers have said. There was an opportunity to expand commitments on universal health coverage, and that opportunity was largely missed. Most of the commitments that will be adopted in this 2023 declaration were already adopted before in 2019 in the prior declaration on universal health coverage. And this is, of course, despite the fact that 4 years have passed and that United Nations member states had to invest time and political resources, and civil society had to invest time and political resources to essentially land on at least many of the issues that I will reflect in the next slide, essentially in the same place where we were before. Some commitments will be made, additional to the prior political declaration, but those commitments are largely weak, and they lack actionable elements, which, like we have just mentioned before with regards to the PPR declaration, that makes enforcement and accountability very, very difficult. So what you see here is a non-exhaustive list of commitments that, if adopted as, you know, if the declaration is adopted later this month, in the current version that we have seen publicly, you know, those commitments will essentially be reflective of commitments that were adopted before in 2019. In some cases, the text is generally the same, and in some cases, the text is slightly different, but the essence of those commitments is the same. And to be sure, this list is only, you know, an illustration of the fact that many of the commitments that will be made this year are repetitive. There are some details in this comparison that are not necessarily reflected in the table. And GHPP, the O'Neill Institute, will be publishing a detailed analysis on the 2023 declaration soon. We refer people to that longer analysis, which it will include this comparison with the 2019 declaration. But essentially, the point is that many of the commitments that will be made were already made before. So one example of this is digital health. In 2019, UN member states recognized the need to protect privacy and digital in the digital environments. And in the 2023 declaration, there will be, if adopted in the current form, a similar recognition of the need to protect data and privacy when using digital technologies to, you know, to make to provide health services. Privacy is indeed one of the human rights that are more likely to be violated when using digital technologies to provide health services. So the recognition of the need to protect privacy in digital health environments is justifiable. We support that recognition. And yet there is also a, you know, increasing concern of the possibility to violate other human rights and other human rights principles when using digital technologies in the provision of health services. The Special Rapporteur on the Right to Health, Dr. T, has raised concerns, for example, about the violation of the principle of non-discrimination in digital environments. And that can happen with regards to artificial intelligence if artificial intelligence is using data sets that are not representative of all of the groups that you know, artificial intelligence or that technology is governing. So only reflecting the need to protect privacy without expanding that commitment further to include, for example, the need to ensure the principle of non-discrimination can be considered a missed opportunity. And a similar analysis can be made with regards to delinkage and other alternative models to incentivize research and development. We support the fact that the 2023 declaration includes language on supporting the linkage incentives and initiative. And yet it is important to remember that the 2019 declaration already had a similar statement recognizing the need to support the linkage and models that separate costs of R&D costs from prices. So the new declaration could have gone further, for instance, making actionable commitments to increase international collaboration towards exploring and implementing the linkage model. And yet, in essence, the 2023 declaration repeats the language that was adopted 4 years earlier. Key and vulnerable populations is useful to illustrate how the 2023 declaration makes some progress and yet still fall short from making the full extent of commitments that should have been adopted in this declaration. In 2019, the Universal Health Coverage Declaration said that, you know, member states should leave no one behind and explicitly mention children, youth, a person with disability, people living with HIV, older persons, indigenous people, refugees, and migrants. The 2023 declaration includes more key and vulnerable populations, which are women, people living in poverty or extreme poverty, people living in slums, people with inadequate housing, and more, and other groups mentioned in the 2023 declaration. Important to know that that was achieved through the negotiation. The CER draft had a shorter list, and the final draft have a longer list. But unlike other precedents in international law, the 2023 declaration failed to recognize other key and vulnerable populations. For instance, there is no mention of transgender people. There's no mention of sex workers, of people in prisons, and people who use drugs. Again, that is a missed opportunity to explicitly recognize the fact that these groups are key and vulnerable and should be included in initiative to achieve universal health coverage. Technology transfer. So since 2019, when the first declaration on universal health coverage was adopted, the political declaration, and largely due to the COVID-19 pandemic, there has been an increasing recognition of the need to facilitate technology transfer to avoid the inequitable distribution of health technologies. So in a sense, it is not surprising that the 2023 declaration includes language referring to the need to facilitate technology transfer, and that is essentially a commitment that can be seen as new because the 2019 declaration didn't have any mention on technology transfer. It was mostly focused on the need to use trip flexibilities. Yet all references to technology transfer are watered down, like other speakers have mentioned with regards to PPR and with regards to TB. Language related to technology transfer in the Universal Health Coverage Declaration is always matched with phrases like where possible or on mutually agreed terms, which makes those type of commitments essentially impossible to enforce and essentially non-binding. And lastly, I'll mention briefly local and regional manufacturing. Again, this is language that was not in the 2019 declaration, again, because since the 2019 declaration, there was a pandemic, there is an increasing recognition of the need to support local and regional production of health technologies to avoid dependence from essentially a handful of rich countries. So we can see this as a positive outcome somewhat, but there is no details on essentially what this commitments entails, and therefore it's very difficult to turn this particular commitment into action. So I'll stop there, Sharon, but welcome your questions and comments.
Thank you so much, Luis. So a reminder, if you have questions for our subject matter experts, so Rajat is here and can speak to PPPR. Luis is here and can speak to UHC. Also, Luis is monitoring some of the provisions across the three agreements and has written and published on this before. Luchika had to drop off on TB, but I wanted to direct your attention to key takeaways, the link that I put in the chat. Okay, so let's turn over to my colleague Alice Koyungo, who is the Senior Associate with Global Health Policy and Politics Initiative. Alice, over to you.
Thank you so much, Sharon, and hello to everyone. So my colleagues have, kept referring to the HIV language compendium, which, which I want to say is a curated compilation of internationally agreed upon language that provides precedents for the promotion and proper interpretation of concepts, terms crucial for an evidence-based and rights-affirming response to HIV and other diseases. The language compendium, which you will be seeing somewhat towards the end of this webinar, does contain terms, many of which have actually been referred to and alluded to since the start of our webinar. And many of these terms are related to HIV, SRH, access to medical innovations, UHC, and so much more. But important to note that these terms are context-specific. We provide context-specific definitions for these terms so that they can be used in a somewhat standardized way. We do have high-level precedent, which basically shows us resolutions and declarations from international governance bodies, as well as, for example, from the World Health Assembly. At the same time, we also have the language compendium does contain the language.
Sorry, Alice, did you want to go on to your next slide? Sorry
Yes.
to interrupt.
Doesn't it show?
Not for me, maybe for others it does. I only see the title slide. There you go. It's also not in slide mode, so people might find it difficult to read. But otherwise, please go.
Can you see? Is it in slide mode now?
No, but I think it's good enough. I meant presentation mode, but it's fine, Alice, please.
Okay. The language compendium does contain intergovernmental precedent, which are presents resolutions and reports related to HIV, gender, discrimination and discrimination. It does provide expert precedent, basically giving us references to recommendations, reports, or special rapporteurs on health, human rights, and HIV. And finally, it does contain intergovernmental evidence, evidence and documents related to HIV prevention, treatment and care, as well as providing WHO guidelines. In terms of use or functionality, the language compendium does provide a set of standardized language that can be, consistent. It's basically terms and concepts that are very helpful to ensure clarity, but also consistency in discussions, and mainly discussions around HIV. It can also be used for rights-based responses, and also provides evidence-based references to international governing evidence-based references to documents that are written by international governing bodies. It does provide does help with policy development, where policymakers can actually use this language in formulating policy documents, and at the same time can be used by advocates to advocate for a rights-based language, which is what we are all looking for. But at the same time, again, the language compendium can be used for education and training, especially when it comes to the different cadres. It could be health workers, it could be social workers, advocates. It can be used for education and training. It can also be used for international collaboration, used for monitoring and evaluation of key terms and language that is used in international documents. And finally, it's basically used for learning. I would want to end with this slide that basically shows us how we can use the language compendium. Some of you have actually inboxed us how best we can use the language compendium. And first is that, it's an online tool that you just need to, to click to use. You can navigate, look at the structure. It has different chapters and subsections. You can explore the different chapters, the different subsections, and basically be able to embrace the rights-based language that has been put in there. You can use it for referencing, during negotiations, but then also it would be good for us to share it as wide and as far so that we have consistency in language that we want to appear in political declarations. Lastly, to mention is that it is a living body, it is a living tool, and it's definitely not final. We ask that you stay informed, keep visiting the website, because we keep updating it and expanding it to include so much more. And the cycle continues, with clicking on the language compendium and basically finding out much more that is in there. I want to end here and hand back to you, Sharon, to take us through.
Oh, thank you so much. And Alice, I'm so sorry. It appears that I was off mute during your presentation, so I hope that wasn't disruptive. So I'd like to show you something, if that's okay. So first, the HIV language compendium. Is this going to be one of those situations when I'm shopping for like Christmas sales and everybody can see it? Okay, so here is the HIV language compendium. Again, is not limited to HIV. We have cross-cutting concepts, as you've heard. This is the list of terms. Now, are going to add to this. So already accountability has come up. Some others have come up in the review by GFAN and others of what didn't make it into the precedents. And here are the precedents. So you heard from Alice about the different sources. Here they are. So you can browse by term or you can browse by precedent. So let's take, gender identity and expression. If you click on a term, you'll be able to read the context-specific definition, as mentioned by Alice, as well as the exact language from the international agreement, as well as the source. And then you can go through and, if you like, download the source. So again, this is, as Alice said, this is a living document. And if you think that's cool, have you ever seen the HIV Policy Lab? Again, not limited just to HIV policies. So the URL is www.hivpolicylab.org. I'm showing you a map, a world map of policies on same-sex sex criminalization, and in this case, non-criminalization. You can go through by country, you can go through by policy, you can analyze countries with each other. So all of this matters in order to give people the tools, the evidence and the arguments, the precedents, and also at the national level to see what your neighbors are doing, to make the point to governments, here's what your peers are doing. Here's what the cluster of countries that you hope to aspire to are doing. This is where you are out of step, either with international agreements or with international norms. That's the point that we hope to make. And all of this is about making sure that the kitty is full, the arsenal is full. I hate to use weapon language, but you get my point. So if there aren't any other questions, then let me see if all have been resolved. There are some open questions. We're going to send the PowerPoints to all of you that have requested. Thank you so much for your interest, and thank you for my colleagues for making those. And if you would like to have it, you can also email my colleague. I've put her email in the chat. It's healthpolicy@georgetown.edu. So, and you might be asking, why are these guys only doing this webinar now when the language is done, when it's too late? So we have, and Luchika mentioned this, we have been feeding different groups with the evidence and arguments and the precedents joining with them in terms of what do you think is missing? Here's how we can help. So as you've heard, it's been helpful in some regard. Others ignore the precedents in terms of the negotiators. So I just want to thank everyone for that experience in terms of working together. But this was helpful because we hope that in the commentary that you might share with media, with government, with your peers, with others in your organizations, to say, well, these are the key takeaways, and to do so holistically. Human rights, key populations, access to medicines, strategies for sustainability. You have now the tools so that if we are able to approach this holistically, we can make sure that we have our own red lines, right? That's negotiator speak. They have their red lines, we have ours. Do not erode these rights, build upon these rights. These are the true benchmarks and that we need to improve upon. Okay, I want to thank everybody. Thank you, Bethany and Hina from the comms team at O'Neill. And for some of you, we will see you in New York at the high-level meeting or some of the events. In any case, what all we want is life off the page. We want better words, and we want the words to be actionable. So we look forward to helping you be a part of that accountability effort. Thanks again. Bye-bye.